you don't realize how much pressure you actually feel in a real life medical emergency. Guys, so the date is Monday the 21st of September. It is the start of a brand new week. I don't know what to expect from this week again, probably more induction training. I'm literally just taking it as each day comes. On Wednesday we've got our basic life support training, so that should be fun. And yeah, I'm all ready to go to work. So yeah, I'm gonna get going now and look forward to the rest of the week. So now that I had finally been fit tested, I had my very own respirator. As you can see, it's got my name on it, and I have to wear this whenever I do any aerosol generating procedures, so AGPs. And before we do this, we have to don. So this is the process of putting on our PPE. So you start with your apron. It can either be a cloth or plastic apron, and then put on the respirator. Check if you've got a good seal, and then pop on the hairnet. You can see I had quite a bit of hair, so just trying my best to cover it up as much as possible, and then put on the visor. So that makes sure that you're fully protected against any sort of aerosols, and then don't forget to put on your gloves. So once you're all donned up, you enter the surgery. You can see here the nurse has already kindly set everything up. And throughout the day, we just done various procedures, including filling, crown preps, dentures, and I was able to help out where I could. So it was nice to do some practical work with my educational supervisors. So after each AGP, we have to doff, which is taking off our PPE. So first you take off your gloves, which ideally you take off in surgery, and then the apron, try and touch the inside only, not the outside. And then you take off the visor, and then the hairnet very gently. And last but not least, this is definitely the best bit, taking off the mask. Honestly, whenever I take off this mask, it's like a weight has been lifted off my shoulders. Good morning guys, so it is Wednesday the 23rd of September. I'm getting ready to leave because we've got our basic life support training today at Waterloo, the lawn deck, so that should be fun. Obviously there's been a lot of changes to the way we're expected to deliver basic life support, obviously because of COVID, so it'll be good to learn about those changes, and I think we're actually going to get to practice it. Yesterday was quite a good day. I don't think I filled you guys in enough. I got back home and I was just slumped, so I didn't record any videos, but I got to do some practical dentistry. So my supervisor Raymond, he had a patient that needed a lower denture, so he got me to take the secondary impressions, and also we done the bite registration together, so it was nice to actually be hands-on. But yeah, I am getting ready to leave now. As always, I will keep you guys updated, and hopefully it's a good day. All right guys, bye. Hey guys, so I've just got out of the station and I am on the way to lawn deck. So I finally arrived at the Long Deck in Waterloo, where I was able to meet up with the rest of the scheme. I also bumped into one of my friends who's on a different scheme, but we went to the same uni together, so it was nice to see each other. Once we were all together, we went upstairs to the room where we would be having our medical emergency training. We put all our stuff away in the lockers, and then we were ready for the training. It's really important that as dentists we know how to manage medical emergencies in the dental practice, such as anaphylaxis, asthma attack, cardiac emergencies, epileptic seizures, hyperglycemic attacks, stroke, syncope, and adrenal crisis. These are all possible emergencies that could take place on a dental chair, so as dentists we need to know how to effectively manage them. Especially life-threatening ones such as cardiac emergencies, so we were able to practice this on the mannequin. After this, we were placed into a room in pairs and we had to manage a random medical emergency scenario. So you can see me there on the bottom right, and you can see some of my colleagues in the other screen as well. So try and see if you can guess what was going on.
Are you breathing?
Apply pads to patients' their chest, as shown in picture. Press pads firmly to patients' bare skin.
Right now the priority is not mobile masks, it's just get
Pull
those
green
pads
tab to
on tape.
remove pads.
Remember we said that earlier, that
Pull
sometimes
pads
now
from liner.
got to get the BDM sorted. It's the deep
Apply pads to patients' bare chest, assessing heart rhythm. Do not touch the patient.
oxygen away.
Analyzing. Do not touch the patient.
Probably don't want to leave the deep in on your cavity. Just,
Stand clear of the patient.
especially if you're going to press the button as well.
Shot and line. Stand clear of the patient. Press the orange shot button now. Shot delivered.
So I'll just replay that whilst explaining what was actually going on. So as you probably correctly guessed, my colleagues over there, they had to deal with a patient that was having a cardiac arrest. So you can see that they were using the AED. My one, you can see the bottom right, it was a bit more difficult to guess because you couldn't hear the sound from that one. But we actually had to deal with a patient that was having an anaphylactic attack. So that's basically allergic reaction. So the patient was telling us that they had peanuts and they felt itchy, they couldn't breathe, and their throat was getting tight, which is one of the main signs. So in order to treat that, we had to give them adrenaline, 1 in 1,000, 500 milligrams, oxygen, call an ambulance, and support their airway as well, whilst trying to remove the offending cause. So there was quite a lot going on. I felt that in this scenario you really feel the pressure, so it was a really good example, and it was good for us to role play it so we can actually feel how it felt to be in an emergency. So once that was done, we were able to have a debrief and talk about things we could have improved whilst watching ourselves back, which was really interesting, and overall I thought it was a really good day. If any of you are interested in finding out how to manage other medical emergencies in dental practice, then I definitely recommend you check out this great resource by the BDA. So after a long day of medical emergencies, it was finally time for us to go home. At this point, we were all really exhausted and thought it'd be a really good idea to go and get a meal to treat ourselves, and we chose the Crossroads in Waterloo. I personally love pizza, so I was happy with the choice, and I just thought it was a really good time for us to come together as a scheme and bond and just talk about what we've been up to in practice. You can see that's Abby, she's really cool, and yeah, no, it was a really good day.
Guys, so it is Thursday the 24th of September and I'm getting ready to go to work. Yesterday I think it was a really good day. We learned a lot about medical emergencies and the changes that COVID has had. I think what was really good about the day is that we got to practice, and you don't realise how much pressure you actually feel in a real life medical emergency. I hope I never have to come across one, but obviously it's important that we're prepared for medical emergencies if they ever happen. So yeah, it was really insightful. It was good to just have a recap on my knowledge and just the changes that have been introduced because of COVID. Obviously, we're not allowed to give ventilations mouth to mouth anymore. You have to make sure you're wearing an FFP3 mask. The patient's mouth has to be covered because obviously when they're breathing, they're producing aerosols, and you're also producing aerosols when you're speaking. So it's important that you're both protected. And yeah, just a lot of changes have been introduced because of COVID, and it's important that we know that in case we're ever faced with a medical emergency. But yeah, right, so I'm gonna get going to work now, and we will see what today has in store.
So I got to work, and then it was time for me to get changed into my PPE. So that's before, and this is after. So it's something that I'm still getting used to doing, but it has to be done before any AGPs.
Guys, check this out. Oh my gosh, this is the new normal for us dentists. It's actually crazy how much PPE we have to wear, but I guess it's for our protection and for the patients. I don't even know if you guys can hear me properly. I probably have to put subtitles or something because I sound like a robot. But I guess this is the new normal.
Right guys, so that brings us to the end of this vlog. If you guys are enjoying my vlog so far, please do make sure to hit the like button and subscribe to my channel. I really do appreciate each and every single one of you. I really do. So yeah guys, also make sure to follow me on Instagram if you're not already. I'm really active on my Instagram stories, so you can see what I'm doing in real time. Okay, so I guess I'll see you on the next video. Make sure to stay tuned because there's lots more to come. So hit that notification button so you know whenever I drop a new video. Alright guys, have a lovely day, and I will see you next time.